There are some new advancements in the treatment of kidney disease. Today we will talk about those new advancements which can delay or sometimes stop use of dialysis in patients with kidney disease. Hello everyone, I am Dr. Sunil Kumar, consultant nephrology and kidney transplant physician from Apollo Hospital, Kolkata. There are many patients in our OPD who have minimal kidney dysfunctions. Like their creatinine is just above 1 or they don't need dialysis, their just creatinine is little bit higher. There is another type of patients whose creatinine have gone relatively higher and they are on the verge of beginning of renal replacement therapy or hemodialysis, sometimes kidney transplantation. There is a third chunk of patients who are already on dialysis or kidney transplantation or peritoneal dialysis. Let us talk about all of them one by one. The first type of patients whose creatinines are relatively higher than the normal, they are the one whose kidney functions are partially lost, which means out of, let us say, 100 of GFR or out of 100 in a number of kidney functions, some numbers are lost because of cell death in the kidney disease, which can be because of any cause, like sometimes diabetes, sometimes hypertension, sometimes painkiller, sometimes alternative medicine intake, sometimes some toxins, and many times we can't even find the cause which led to the kidney disease. So in these type of patients, our main role or major purpose of the treatment is to delay the progression of kidney disease so that the remaining functions, the kidney which is functioning as of now is saved, and the kidney part which is like dead or the cells which are dead and which are not functioning, we try to revive them, but usually it's a futile process, and mainly treatment helps in taking care of the cells which are viable or the function which is available. We try to save that part. So recently there have been some medications which have helped keeping these cells alive and keeping their functions well in functioning stage. So one is SGLT2 inhibitors. These are the drugs which are used also in the treatment of diabetes, but recently there have been trials in which they have shown that these type of drugs can be used not just in diabetes but also in kidney disease without diabetes. Using these kidneys which are cells which are viable, they are saved for a longer time, and patients are saved from going to dialysis for a longer period so that we can avoid dialysis. Apart from this, there are other few more drugs like finerenone, eplerenone, and some dietary modifications have come up, or using all these we can delay the loss of kidney functions. In fact, if you see from the historical point of view, around few decades back only, 1 or 2 decades back only, the loss of GFR was 100 ml per year, which means in around 10 years span, whole of the kidney function will be lost. But with the use of ACE inhibitors and thereafter newer medications, the loss is only 4 ml or even less, which means the same kidney will work for 30 or years or so. So this much years patient get to avoid dialysis. Second type of patients, let us talk about those patients who are already on the verge of initiating dialysis. These are the patients who have common questions when they come to my OPD, like what are the various options when they have reached a late stage, when they need renal replacement therapy, when their kidneys are not functioning at all and they need outside support. Then there are three type of options. One is hemodialysis, we are all well aware of, in which it's basically sort of artificial kidney. In fact, this is the only organ in our body which can be artificially supported from outside. If the kidneys are failed, patient will go to the hospital, get hooked to a machine and take hemodialysis, which is like a blood cleaning for a few hours. Thereafter will go home on the same day. Sometimes patients also want this type of therapy to be available at home, so many patients keep this type of machine at home and takes night time of dialysis at their own ease. Second type of treatment is peritoneal dialysis, in which a small catheter is put in the abdomen, and there are special type of fluids which need to be instilled into the abdomen by adding to channels. After a few hours, this fluid is drained out from the gravity, which takes away all the toxins from the body and cleans out the body, and patient do this themselves at their home. third is kidney transplantation. I said third, but it should be the first though, because it gives the best quality of treatment. If there is a donor available, live or sometime deceased, then patient should go for kidney transplantation, which gives the best quality of life. In fact, the points which I started from, like the newer type of drugs, these type of drugs have also shown benefit in kidney transplantation. If we use these drugs in patients who are kidney transplant, the new allograft or the new kidney works for a longer period. So I hope I have answered most of the questions regarding keeping our kidney healthy, options of renal replacement therapy, and best options is the kidney transplantation, as I said. Thank you very much.